Today we're discussing complementary therapies for vitiligo. As always, this is for informational purposes only and not medical advice. Enjoy. Welcome back everybody to our vitiligo series. Today we're talking about complementary therapies to vitiligo. So we made a video on traditional medical therapies and surgical therapies, but there can also be complementary therapies that patients would like to try because vitiligo can be a very tough condition to treat. I always like to advocate for complementary therapies as long as they're safe. But that being said, again, these are complementary, not alternative. So I do think it is important to talk to your dermatologist about the traditional therapies that are known to be effective in randomized clinical trials, and then to talk about additional complementary therapies that are safe for you as an individual. So the first is vitamin B12. We'll talk about vitamin B12 and folate. Here you can see that vitamin B12 is important for a lot of different functions, red blood cell production, nerve function. It can be found in various foods, and of course you can supplement it. Same thing for folate or vitamin B9, important for various cellular functions and can be found often in leafy greens, fruits, beans, and fortified grains. So this study from Cutis in 1992, which is one of just a couple studies, showed that a small cohort of patients that were low in vitamin B12 and B9, the folate, demonstrated improvement in a good number of the patients, 8 of these patients, with 3 years of supplementation. That being said, this is a small patient cohort. It is not a randomized clinical trial. There does not appear to be any controls or matching of patients. And so what I can take away from this is vitamin B12 and B9 may help, particularly if you're low. The evidence is minimal, but the harm with taking a little bit more vitamin B12 and B9 is also minimal, and it's something you could consider doing after speaking with your physician. Vitamin D. Now, I'm a big proponent for vitamin D because I think most people are too low in vitamin D, and the studies continue to show that adequate to high levels of vitamin D can be very beneficial when taken safely for various aspects of your health, particularly your immune health and particularly for cancer prevention. So, one study showed that prolonged administration of high doses of vitamin D helped with vitiligo and psoriasis. But I want to highlight something here. So, there were 16 patients with vitiligo. They received daily vitamin D3 of 35,000 units. 14 out of the 16 patients had 25 to 75% repigmentation. So that's a big range. And so let's break that down. 16 patients, not a whole lot of patients. 35,000 units a day is a lot of vitamin D and can be toxic. 14 out of 16 patients, so not all the patients, but a good majority of the patients, had somewhere between a fourth to three-fourths repigmentation. Again, it is not clear if these patients repigmented just because of this vitamin D or if there were other causes. It's not randomized, it's not controlled. So take this with a grain of salt. I think everyone should have their vitamin D checked at some point. If it's low, I think supplementing with vitamin D safely, not 35,000 units every day, can be done. And if that improves your vitiligo, great. But I do not think you should start taking high doses of vitamin D to improve your vitiligo. I actually think that can be very dangerous. So vitamin D, potentially helpful, definitely something you should talk to your doctor about and monitor closely. Polypodium leukotomas. So the most classic Polypodium leukotomas brand is HelioCare. There are other things now like sun powder among other things, but this fern has been shown to help with skin health, particularly as it relates to UV sunlight damage. Interestingly enough, when you combine this fern, the Polypodium leukotomas, with narrowband UVB treatment, which is a phototherapy treatment for vitiligo, which was discussed in a previous video, patients with that combination did much better in regards to the repigmentation when compared to patients that just got the narrowband UVB alone, 47 versus 22%. So something that maybe by itself doesn't necessarily help vitiligo, but something about that interaction with narrowband UVB leads to improved repigmentation, and this has been reflected in multiple studies. Here's another study, Nigella sativa. I'll be honest, I did not know what this was before doing some of this research, but basically it's a seed oil. You can take it orally or you can apply it to your skin. There have been a couple different studies. There's even a review regarding Nigella sativa for vitiligo treatment. This study in 2019 found twice daily application of this seed oil led to significant repigmentation in 33 patients. Another study in 2014 compared application of this seed oil compared to fish oil. Interestingly, application of both oils led to improvement in these patients, but interestingly, the application of Nigella sativa was more effective than the fish oil in reducing the vitiligo burden, predominantly in the upper extremities, the trunk, the head, and the neck. Diet and vitiligo. Really not a lot of good data. For most patients with any condition, whether it's acne, hidradenitis, vitiligo, I recommend healthy antioxidant diet. I typically have them research Mediterranean diets, high omega-3 diets. There are some case reports, for example, for gluten in a young female patient who was gluten insensitive. When she took gluten out of her diet, her vitiligo improved. Now, that's a case of one, and that cannot be reflected across a general population. But we know that vitiligo is a little immune dysregulation. If we eat a diet that is antioxidant rich and helpful for our immune system, potentially could help with vitiligo, but by no means should you start avoiding certain foods or limiting your diet in an unhealthy way to treat vitiligo. Remember to always consult with a healthcare professional before trying any alternative therapies. Always be careful with supplements and alternative therapies. Remember, these are not regulated by the FDA at this point, so you always want to make sure that you're trusting brands that have done the due diligence, that are backed by independent labs, and always talk to your healthcare provider to see what makes sense for you. If you found this helpful, or if you know anybody that has vitiligo that might find this helpful, please send this to them. It helps my channel. And of course, I'd like to get this information out to as many people as possible. And as always, have a nice day. Thank you for your support.